It's a pleasure and a privilege to be here, and in the next 10 or 15 minutes I want to share my insight into what actually goes through a surgeon's mind. Trust, touch, discuss and embrace. These are the 4 tenets of development that we as surgeons go through. We have to trust our patient as they have to trust us. We need to touch them to understand the physicality of it, touch their emotions. We need to discuss the problems that they have and embrace the outcomes. All of you may have read and seen in newspapers about the violence that has been happening with doctors. And if you look at the social media, it's all over, and some pretty gruesome episodes have happened. And that is a sad travesty of what we actually go through. It's important to understand that the trust and faith that we started off, I am possibly the oldest person in this room. I'm 72 years old. I've been in orthopedic practice for the best part of almost 50 years, in active practice for 45 years. And a lot has changed. Earlier we used to trust patients, they would come, they would discuss a problem. Unfortunately, a lot of that has changed, and the reason for that is the definition of the doctor-patient relationship. The doctor has become a service provider, and we are giving that service to the patient. So medicine has actually become a commodity. We have become accountable. We were accountable earlier, but we are now accountable in a slightly different dimension. It is important also to understand that because of the very nature of the social media, the earlier speaker very eloquently spoke about social media. There's a lot that goes on in social media. So when we get a patient, he already has half-baked knowledge from the social media, Google, and so on. And we have to deal with that. The deliverables have changed, the delivery systems have changed. Accountability has remained the same, but there's a different pathway for that. It's also important to understand that when we look at our human body, the human body is possibly the most intricate interplay of the most complex AI systems, which none of us really truly understand. And also when we look at the human body and we think of something as basic as fever, fever is one of the most complicated problems that we can deal with, and we deal with the surgical enterprise. We deal with the human bodies. And these are 3 very important people in my life. The gentleman on my left and your right possibly, John Charnley. He is the father of hip replacement. Some of you may have heard of it. Some of you and your families may have undergone this. The man on the right was the man who developed total knee replacement, and some of you may have heard of that surgery. And the gentleman in the middle was the man who trained me. He was my mentor. I worked with him for 5 years in England. And a lot of what I learned comes from him. And the basic theme of what goes on in the surgeon's mind really sort of drew its inspiration from a small anecdotal episode that happened when I was working with this gentleman in the middle. His name is Mr. Graham Hayes. We had a set of complications during surgery where the patient had a lot of problems. And the post-operative period, I was asked to go and deal with the parents of this child. And I went and told them that everything had happened well, everything was all right, and so on and so forth. And my consultant called me back and said, "What did you tell the parents?" And I told him everything was fine. He called them back and said, "I apologize, this youngster has just come from India. He's a little bit off center. We actually created a lot of problems in your child's surgery," and enumerated every complication that had happened and added at the end of it that we have put the whole problem behind us, right? The child is all right. However, would be agreeable to the fact, if you were to sue me, I would agree for an out-of-court settlement. Imagine the fortitude and the courage of this man who was willing to stick his neck out and go out and tell a parent that he had messed up his child's surgery. The parents were very agitated, angry, and they said, yes, we will sue you. And I couldn't sort of take that, so I said to my consultant, I said, sir, do you mind if I have 5 minutes with the family? And I asked him a question. I said, if he had not been honest with you and mentioned that these complications have happened, would you have ever known about it? And they said, no. I said, should you be penalizing him or should you be praising him for his honesty? That resolved the issue for my consultant, for the child, the parent, and most importantly for me, because I learned at that point of time what it was like to deal with a complication. This is a very, very telling slide. We talk about success. We spoke about everybody in this room being aspirational, wanting to do well in life. Success is what we all aim for, and we all have our different definitions. But those of you who are within quotes successful also undergo a period of trials and tribulations because you're under scrutiny all the time, and with your increased responsibility, you are always in the spotlight because people are looking at you critically. They would forgive a mistake from somebody else, but somebody who's really established, the tolerance for mistakes is very, very low. And again, sort of flipping back, this is the man who inspired me to be a doctor. This is Christian Barnard. For those of you, you're too young to know him, but let me give you a little brief about him. He's the man who did the world's first heart transplant. It happened in a hospital called Groote Schuur Hospital in Cape Town. That's the man. The patient's name was Dennis Darwal. She died in an automobile accident, and the name of the recipient was a man called Louis Washkansky. And he became an overnight celebrity. He was also handsome, very handsome. All the girls were flipping around, running after him. All the actresses, Sophia Loren, and again, before your time, gorgeous Italian women and models. And after he did his 4th surgery, he decided to call it quits because the speculation was so high, expectations from him were so high. And at that time, as you might imagine, surgery was not really defined. All these patients were dying. By the time he got to his 4th and his 5th, he decided enough was enough, and he decided to call it quits. So here's a man, top of his game, one of the most successful surgeons in the world, calling it quits because of the increased expectations. So expectations are something that come naturally with success. In a branch and a field like medicine and surgery in particular, this is quite a difficult problem to deliver time after time. And this is really the reason why. You know, you do 5 surgeries, they all do well, and one gets infected. You have done the same day, same protocol, everything. Why does one patient get infected, one patient does not get infected? And today we know that you've heard of the DNA and the genomes. All of us in this room, every single one of us carries about 1 trillion bacteria inside your body. We are all a absolute reservoir of some of the most lethal bacteria. But it does not spark, you're not sick because your immunity system triggers are kept quiet. It is under wrap, but sometimes in a certain situation which we do not yet know why or what, that trigger happens and that patient gets infected. And these are called the microbiome, and these are the areas where these microorganisms live. Skin, oral cavity, respiratory cavity, the gut, the stomach is actually the most important hollow organ in the body that dictates your future health, and the genital tract. And this comes in when you are in utero, when you are in your mother's uterus. This happens at that point of time, and this is called a holobiont. This is a synergistic existence, which means it stays in cohesion with the host. and does not really get activated unless there's that trigger. And that trigger is really what we're all after. And when we look at, in my field, osteoarthritis, which is where you see a lot of elderly people walking with difficulty, legs are bent. If you go to a temple or a gurdwara or railway station, you'll see a lot of people limping. A large part of them have osteoarthritis, and this is again dictated by the bacteria inside of your stomach. And this gentleman, Dr. Loser, got awarded the research award for tying up this correlation. So you cannot undo the moves, but you can make the next step better. So when we run into complications, let me say that every single surgeon in the world will have about 3 or 4 patients who will not do so well. And this slide epitomizes really what I'm saying. You cannot undo what has happened, but you can make the next step better. You need to sort of to debate that, try and understand what happens, and then try and find the solution to that. Sir C.V. Raman, a lot of you probably have heard of him. He was a Nobel laureate. I'm the master of my failures. If I never fail, how will I learn? And I think one of the host said, if you don't fail, you don't learn, and each failure should really be a step forward, and it should educate you that much more. Very well said. So I want to end this by just saying that we've done close to about 65,000 surgeries, and when I reflect back on my own career, my failures, patients who did not do as well as I would have liked them to. We look at them, we treat them, we counsel them, we guide them. Most importantly, we have to be honest with them. We have to be honest and truthful with them. We need to give them hope and take them into confidence. And it is honesty and hope that makes sure that those patients stay with us. And I would say about 80% of our failures have continued to stay with us. And I'm very glad to say that some of them have actually become one of the most integral part of my extended family. They are people who are part of my family. I sort of go to their houses. They come to mine. We share our celebrations together. So when you have something that does not go as well as you would have liked it to go, sit back, take a step back, reflect, be honest, ask for another opinion, seek help. Oftentimes, when you're in trouble, your thinking stops or it goes in a linear direction. Look at it from a much broader perspective, and if you're able to do that, you'll probably find the right solution. And in spite of it, sometimes when you have failures, the patient suffers, but I can tell you one thing, the amount of suffering that goes through the mind of a surgeon, he has sleepless nights. So it's not easy for the patient, it's definitely not easy for the surgeon. A lot of careers have ended because people are not able to deal with those failures. Fortunately, we have soldiered on, we have learned from our mistakes, we continue to do a lot of operative work. But the one message I want to put out there is, failures are your biggest learning and your biggest way to success. I'd like to thank you for your attention.